Heart failure. Heart failure predominantly affects older individuals. Its occurrence is infrequent below the age of 65 but sees a significant surge as age advances. The onset of heart failure is gradual, making early detection challenging due to subtle symptoms. Initial signs that patients might notice include tiredness, difficulty breathing, breathlessness when lying down, and nighttime breathlessness. As the severity of the condition escalates from mild to moderate or severe stages, individuals may observe swelling in their ankles and might develop a bubbly cough that produces sputum with a pinkish hue. Bronchiectasis. Bronchiectasis results from the permanent widening of the bronchi. It's often misdiagnosed, with many assuming it's chronic obstructive pulmonary disease. Typically, affected individuals exhibit a persistent cough that lasts for an extended period. More than 75% of these patients experience daily coughing accompanied by sputum production. Shortness of breath is another frequent symptom. Around 1/3 of these patients might also experience wheezing and discomfort in the chest. Tuberculosis. Tuberculosis is an infection stemming from the Mycobacterium tuberculosis bacteria, primarily spread through the air. The disease predominantly affects economically disadvantaged groups, with nearly half of the cases linked to such groups. The majority of TB cases in the UK are among individuals born outside the UK. TB's progression is gradual, starting with mild symptoms. Individuals often have a long-lasting cough, and the amount of sputum can range from minimal to significant, sometimes even containing blood. Other signs include general fatigue, fever, night sweats, and weight loss. However, not every person will display all these symptoms. If someone has a persistent cough for over 3 weeks and shows one or more related symptoms, especially if they were born outside the UK, they should seek further medical evaluation. Diagnostic tests like chest X-rays and sputum tests can help confirm the presence of TB. Carcinoma of the lung. Multiple research studies indicate that during the advancement of lung carcinoma, up to 90% of patients might experience a cough. The risk of this cancer type escalates for long-term smokers who've had a persistent cough for several months or notice a significant alteration in their cough's nature. The cough typically yields minimal sputum, which may have traces of blood. If an individual over 40 years old exhibits 2 or more symptoms, such as coughing, fatigue, breathlessness, chest discomfort, weight reduction, or decreased appetite, they should have a chest X-ray. Lung abscess. A common manifestation involves a dry cough accompanied by sharp chest pain and difficulty breathing, predominantly seen in older individuals. Other indicators like general discomfort and fever might also arise. As the condition progresses, the cough results in the expulsion of a significant amount of thick, often bad-smelling sputum. Spontaneous pneumothorax. Spontaneous pneumothorax, or a collapsed lung, can occur due to the bursting of bullae, tiny sacs filled with air or fluid in the lung, although it usually arises without any evident cause. It impacts predominantly tall, slender men aged between 20 and 40. Factors like smoking and a familial history of pneumothorax elevate the risk. This condition can be critical, leading to a dry cough and intense breathing difficulties. Affected individuals report sudden, acute pain on one side of the chest that intensifies during inhalation. These symptoms can emerge abruptly, even during relaxation or sleep. Gastroesophageal reflux disease. While gastroesophageal reflux disease typically doesn't manifest as a cough, those with the condition might experience coughing when in a lying down position. These individuals may also display signs of acid reflux or heartburn. People tend to have heightened cough reflex sensitivity, and they often benefit from treatments with proton pump inhibitors. It's essential to consider this condition as a potential cause in cases of unidentified cough. Nocardiosis. Nocardiosis is a notably rare bacterial ailment stemming from the Nocardia asteroids bacteria, mainly spread through inhalation. While it's an improbable cause, the disease is more prevalent among the elderly, particularly in males. Affected individuals might produce thick, possibly blood-streaked sputum. Fever is a dominant symptom, and they might also experience night sweats, sharp chest pain, weight reduction, and general fatigue. We really hope you enjoyed our video and found it informative. Please kindly give us a thumbs up, share and subscribe for more content. Please give us your suggestions for future topics in the comments section.